You are lying in bed and the room is completely quiet, and then you hear it. That soft, rhythmic sound, your dog licking their paw again. Third night in a row, same paw, same spot, and you have no idea why they keep going back. That sound is not a quirk, it is your dog telling you something is wrong. And most owners spend months trying to stop the behavior when the real answer is finding the cause. In this video, I will walk you through every major reason a dog obsesses over their paws, how to tell them apart, and what you can do about it at home. One of those causes, the one almost nobody thinks to check, is sitting in your dog's food bowl right now. I will get to that one. I am a veterinarian, and I have been treating dogs for more than 20 years. Let me know in the comments where you are watching from today, and grab a pen if you have one nearby. There is one thing I need you to hold on to through everything that follows. Paw licking is always a symptom. It is never a habit, never just something certain dogs do. Every dog that obsessively licks the same paw is responding to a real physical sensation or managing a real emotional state. Our job, yours and mine, is to figure out which one. I know some of you have been at this a while. You have pulled your dog away from that paw, tried the bitter sprays, maybe put a cone on for a few weeks. And the moment the cone came off, they went right back. I want to say clearly, that is not your fault. This problem genuinely confuses veterinarians on the first visit. The triggers overlap, the signs look alike, and your dog cannot tell you what hurts. The fact that you are here still searching for an answer says everything about the kind of owner you are. The bitter spray approach is the most common thing I see owners try, and the most common reason the problem drags on for months. Putting a spray on an itchy paw is like putting duct tape over a warning light on the dashboard. The light stops blinking, but whatever triggered it is still running. Your dog is not licking their paw because they enjoy the sensation. They are licking because something is bothering them there, and until you find that something, the licking will find another outlet, another paw, the base of the tail, the belly. So instead of stopping the behavior, let us find the cause. The paw is a contact surface. It touches every surface your dog walks on, encounters every allergen on the ground, and gets groomed with the mouth. Between the toes, there is a warm, slightly humid space with almost no airflow, one of the most hospitable spots in your dog's body for yeast and bacteria. Add moisture from licking and you get a self-reinforcing cycle. Irritation leads to licking. Licking adds moisture and bacteria, which intensifies the irritation. One of the clearest visual signs that this cycle has started is fur that has turned rusty reddish brown between the toes. That stain comes from compounds in dog saliva called porphyrins, which oxidize on the fur after extended, repeated licking. If you see that staining, it tells you two things. This has been going on longer than it looks, and the licking is focused and deliberate, not occasional grooming. Now let me walk you through what each trigger actually looks like, because careful observation will usually point you toward the right one. The first cause most owners think of is environmental allergy. The clinical name is atopic dermatitis, which means the immune system overreacting to pollen, grass, mold, or dust mites in the environment. Environmental allergy follows a seasonal pattern. The licking gets worse in spring and fall when pollen is high, and eases in winter. When a dog walks through a yard during high pollen season, those particles coat the paws like chalk dust on a blackboard, and the dog licks them off and absorbs even more through the skin. Alongside the paws, watch for recurring ear infections, redness on the belly, and face rubbing. That cluster, paws, ears, belly, face, is the signature of environmental allergy, and recognizing it early saves a lot of time. The second thing to check has a very specific sensory clue you can detect yourself. Every dog has a naturally occurring yeast called malassezia on their skin. In healthy amounts, it causes no problem. But when something tips the balance, usually an allergy weakening the skin barrier or chronic moisture from licking, malassezia multiplies beyond normal levels and produces its own irritants that intensify the itch. It also releases a recognizable smell, the corn chip or Frito smell that comes off your dog's paws when you hold them close. A faint version of that smell is normal. An intense, sour, almost fermented version means the yeast is out of balance. Other signs of overgrowth include the reddish-brown staining, small pink bumps between the toes, and slightly thickened or scaly skin. Malassezia is almost always a secondary infection sitting on top of an allergy. It makes the itch worse, and it will keep coming back until the underlying cause is found. If this sounds like your dog, this video is already saving you a lot of time. And if you are finding it helpful, hit subscribe. It helps me reach more dogs who need this. A third cause that gets overlooked more than it should is fleas. Most owners look at the paws and say they do not see any fleas there, and they are right, because the paw is not where fleas live. But flea allergy dermatitis, an allergic reaction to flea saliva, causes generalized itch across the whole dog. The dog ends up licking their paws not because the paws are the source, but because the generalized itch needs an outlet and the paws are easy to reach. Check the base of the tail, the lower back, and the belly for dark specks or signs of scratching. One flea bite every few weeks is enough to keep a flea allergic dog in constant itch, even if you never see the flea itself. Year-round prevention, especially in warmer states where fleas are active most of the year, is the only thing that actually fixes this. And then there's the cause that surprises people most. A dog that licks one specific paw, always the same one, near the wrist joint or the base of a toe, with no seasonal pattern, no corn chip smell, and no visible skin changes, may not have an itch at all. That dog may have pain. I saw this with Cooper, a 7-year-old beagle whose owner had been changing his food and trying supplements for months with no improvement. When I flexed Cooper's left front wrist during the exam, he winced. X-rays showed early-stage arthritis in that joint. He was licking the sore spot the way a person rubs a stiff shoulder, not because it itched, but because the motion provided brief counterstimulation against constant, low-level discomfort. The right pain management stopped the licking completely within 3 weeks. The lesson: if your dog's licking is always the same paw, always near a joint, and you notice any stiffness when they get up, that is a vet visit, not a home remedy situation. Now, I said at the beginning that there is one trigger almost nobody thinks to check first, and that it has to do with what is in your dog's food bowl. Let me tell you about Bella, because her story is the one I come back to most when owners are stuck. Bella was a 4-year-old golden retriever whose owner had noticed her licking the same front left paw every evening for 3 months. The fur between 2 toes was rust-colored and slightly thinning. No raw sores, no limping. An antihistamine had helped for about a week and then stopped working. What was most telling, the licking happened year-round, every season, with no change. And she had been on the same chicken-based kibble for 2 full years. Those 2 facts together pointed me toward a food allergy. Here's how food allergy works in dogs and why it hides so well. When a dog develops an immune reaction to a protein in their food, most commonly chicken, beef, dairy, or wheat, the reaction does not usually show up in the gut the way a human food allergy does. It shows up in the skin. Think of it like an allergy that expresses itself not in the throat or the nose, but exclusively in the fingertips, the most distal, most sensitive point. The most vulnerable skin on a dog's body is the paws, the ears, and the belly. A dog with a chicken allergy may have perfectly normal stools and still spend every evening licking their paws because the immune system is mounting an inflammatory response in the skin every single time they eat. The critical distinction from environmental allergy is that food allergy does not follow seasons. It is constant. If your dog's paw licking is year-round, persistent, and does not improve in winter, and especially if the same dog has recurring ear infections, food allergy belongs at the top of the list. For Bella, we started a hydrolyzed protein trial alongside daily omega-3 and twice-weekly ACV soaks on the intact skin. 8 weeks later, her owner sent me a photo. The staining was fading, the licking had dropped to occasional, and Bella was sleeping through the night. That one change, looking at the food bowl, gave her back her peace. Before the protocol, let me show you what happens when this is left alone, because understanding the progression is what makes acting now worthwhile. At the start, the licking looks harmless. The skin is intact, the fur is slightly damp. Left unchecked, the daily moisture weakens the skin barrier. Malassezia yeast, sitting quietly at normal levels, starts multiplying in the warm, damp environment. Its own irritants intensify the itch. The dog licks more. The skin thickens and becomes scaly. The corn chip smell gets stronger. Then the skin cracks. A small break in the barrier is enough for bacteria to enter alongside the yeast. Now there is a secondary bacterial infection on top of the yeast on top of the allergy. The paw becomes hot, swollen, and painful, and the dog needs prescription antifungals and antibiotics to recover. What started manageable has become a weeks-long treatment process. And for the dog whose root cause was pain, every week without a diagnosis is another week of unnecessary discomfort and further joint damage. The first practical thing you can do for a dog whose paws are intact with no raw skin and no open sores is an apple cider vinegar paw soak. The mild acidity of ACV creates an environment where Malassezia yeast struggles to survive and reduces surface bacteria. Use raw, organic, unfiltered apple cider vinegar, the kind with the mother on the label. The ratio is 1 part ACV to 1 part water, 50-50, that is all. Pour it into a bowl deep enough to submerge the paws and soak for 3 to 5 minutes. Dry the paws thoroughly with a clean towel afterward. Leaving them damp defeats the purpose because yeast thrives in moisture. The concentration is the same for all dog sizes, only the size of the bowl changes. Do this twice a week as maintenance or after every walk when symptoms are active. And now the part I need you to hear clearly. If your dog's paw is raw, cracked, bleeding, or has any open sore, skip this soak entirely. Vinegar on broken skin causes real pain and can damage healing tissue. If the skin is broken, the soak is off the table, and the next step is your veterinarian. The second intervention works from the inside out and addresses the root vulnerability. Fish oil, specifically the omega-3 fatty acids EPA and DHA from marine sources, rebuilds the skin barrier the way mortar holds bricks together. Think of your dog's skin as a brick wall. The bricks are the skin cells, the mortar is fat. When the diet is low in EPA and DHA, that mortar cracks and allergens pass through more easily than they should. Daily fish oil refills it, tightens the barrier, and reduces the skin's inflammatory response over time. Results take 4 to 8 weeks of consistent use. This is a foundation, not a quick fix. Use a marine source, sardine, salmon, or anchovy oil. Plant-based omega-3 from flaxseed contains a different type of fat that dogs cannot efficiently convert into the EPA and DHA their skin needs. Read the label for the combined EPA and DHA milligrams specifically, not total omega-3. For dosing, small dogs under 25 pounds, about 250 to 500 milligrams of combined EPA and DHA per day. Medium dogs between 25 and 50 pounds, 500 to 1,000 milligrams. Large dogs between 50 and 100 pounds, 1,000 to 2,000 milligrams. Start at the lower end to avoid loose stools. The third tool is the one owners least think of as a medical decision, but for some dogs it matters most. Anxiety-driven licking looks exactly like allergy-driven licking on the surface, which is why a vet should rule out physical causes first. Once they have, the answer is not a remedy, it is stimulation. A bored or chronically stressed dog defaults to self-soothing licking the way a person bites their nails. The intervention is meaningful activity. A 15-minute sniff walk on a long leash, going at the dog's pace, following their nose, one of the most effective mental fatigue tools at zero cost. Add a food puzzle or lick mat at mealtimes. Rotate toys every few days. For dogs whose licking peaks around your departures, a food puzzle given exclusively when you leave can interrupt that anxiety pattern at its most intense moment. Let me bring all of this together now. The 6 causes are environmental allergy, food allergy, Malassezia yeast overgrowth, fleas, pain or arthritis, and anxiety or boredom. They often overlap. A food allergic dog almost always has secondary yeast on top of it, which is why treating only the yeast keeps failing. Look for the distinguishing clues. Seasonal licking points to environmental allergy. Year-round licking points to food allergy or anxiety. One paw near a joint with no smell or staining points to pain. Strong corn chip smell with rusty staining means yeast, secondary to something else. Biting at the tail base alongside paw licking means check for fleas first. On the intervention side, do not start everything at once. Begin with fish oil today. It takes the longest and does the most foundational work. Add the ACV soak in week 2 if the skin is intact. Bring in enrichment whenever there is a behavioral component. Change one thing at a time so you know what is working. If 4 to 6 weeks of home care brings no real improvement, that is a clinic visit, skin testing, a food elimination trial, or an orthopedic exam, depending on what the signs point to. One more connection worth knowing. Dogs whose allergies show up on the paws almost always show it in the ears too. If your dog has recurring ear infections alongside the paw licking, those are not 2 separate problems. They are the same immune overreaction in the body's most sensitive areas. Fixing the root cause tends to improve both. Does your dog lick their paws? And after everything we covered today, which cause sounds most like what you are seeing in your dog? Tell me in the comments, is it the paws only or the ears too? I read every one. If this video helped you understand what your dog has been trying to tell you, subscribe so you do not miss what comes next. and a like helps me reach another dog owner who needs this. Go check your dog's paws tonight. Bend down, look between the toes, give them a smell. And when your dog looks up at you in that moment, that attention is already part of the treatment.